Mabuhay future nurses! Welcome to Maternal Nursing 101 with me, your student nurse, Edmond. In this video, I'll be performing the Leopold's Maneuver. Leopold's Maneuver has 4 steps, wherein we use palpation as the primary technique in order for us to palpate the gravid uterus. It is common and systematic way that actually help us, that enables us to determine the lie, the presentation of the fetus inside the uterus. Preferably, Leopold's maneuver is done on the 24th week gestation because in this period, the outline of the fetus can be palpated. Now, without further ado, let's get started. Before starting the procedure, I will be first washing my hand and practice any other infection control procedures. After that, I will now be explaining the procedure to the client. Magandang umaga po, ma'am. Ako po si Edmond M. Bigata. Student nurse po ako from Camarines Sur Polytechnic Colleges. Ang mangyayari po ngayon, ma'am, ay magkakaroon po tayo ng tinatawag na Leopold's Maneuver. Ang mangyayari po dito ay kakapain ko po or ipapalpate ko po ang certain part ng inyong abdominal area para po malaman po natin ang kasalukuyang kalagayan at posisyon po ng bata sa inyong sinapupunan. Okay lang po ba ito sa inyo, ma'am? Sige po. Now, I will be asking or I will be assisting the client to urinate. Why? Because full bladder will disable us to have a better palpation of the uterus because sometimes full bladder deviates the position of the uterus into the lateral side. Now, after assisting the client into urination, I will be positioning the client in a supine position with her neck slightly flexed. Doing this position will help the client to relax her abdominal muscles. And after that, I will be putting a rolled towel just underneath on the back of the patient. Ma'am, ilalagay ko lang po ito. So putting a towel underneath the patient will actually tilt the uterus away from the inferior vena cava because if the uterus press against the inferior vena cava, it might cause a supine hypotension to the patient and can be life-threatening. Okay? So now we will be performing the first grip, which is called the fundal grip. Now what we will be doing here is that we will be palpating the upper part of the uterus, also known as the fundus. Ginagawa natin ito in order for us to determine kung anong part yung present sa fundus. If we palpated something soft, it means that the buttocks is located at the fundus and the presenting part is the head. But if we palpated a hard material on the fundus, it means that the baby is in a breech position and the buttocks is the one that is in the pelvic inlet. Now I will be using my hands to palpate the fundus of the patient. Okay. And then, we will now be proceeding to the second maneuver, otherwise known as the umbilical grip. What will happen here is that I will be placing my hands on the abdomen of the patient and I will start palpating on one side first, leaving my other hand stationary. And then, I will be placing my right hand stationary and as well be moving my left hand to palpate the other side of the abdomen. This maneuver actually helps us to determine the location of the fetal back. And determining the fetal back is very crucial in fetal monitoring because the fetal back will tell us where the loudest fetal heart tone can be heard, and can be helpful when we monitor the fetal heart tone of the client using the Doppler ultrasound. Now, I will be performing the third grip, the third maneuver, also known as the Polix grip. Now, I will be using my fingers, specifically the thumb and the index finger, and placing it just above the symphysis pubis, and try to bring the thumb and the index finger together. This is to determine the what is the presenting part presenting on the pelvic inlet, and we will be assessing if it's firm or if it's soft. Now, performing the last maneuver, we'll now be performing the pelvic grip. Facing the feet of the client, I will be palpating just 2 centimeter above the inguinal canal, the inguinal ligaments. There. Palpate. I am palpating it. Okay. So, that is the Leopold's Maneuver. Now, after performing the Leopold's Maneuver, we will be measuring the fundic height of the patient. So, using a tape measure, beginning from the fundus up just above the symphysis pubis, so it is 30 centimeters. Measuring the fundic height actually help us to determine the gestational age, because sometimes the measure of the fundus, the measurement of the fundus is equal to the weeks of gestation. So since that the fundic height of the mother is in 30 centimeters, it can also mean that the fetus is at 30 weeks gestation. And after performing those procedures, we will be putting the drape back. We will be telling the findings, and we will be as well as recording it using proper documentation and perform proper hand hygiene. So, that's how we perform the Leopold's Maneuver.